From Robert Wood Johnson University Hospital, this is Medically Necessary.
Welcome to Medically Necessary, the official podcast of the Robert Wood Johnson University Hospital medical staff. I'm Chris Hoenig, joined as always by Dr. Jim Salwitz. Dr. Salwitz, another beautiful day in the medical neighborhood.
It really is, a little spring out there. So I'm kind of happy and excited to be moving forward into this new time. So it's a great time in the hospital here and in the state.
We really do want to talk about, this moving forward, this, kind of changing of the seasons, not just outdoors, but inside the hospital too, with COVID numbers coming down, thankfully, certainly not what they were a couple months ago. It's a different feeling, and we have different leadership taking us through this phase now. Bill Arnold, the interim president and CEO of Robert Wood Johnson University Hospital, joining us now. Bill, thank you so much for joining us. And, I just want to ask straight off the bat here, you've been with us now for several months. What observations have you made coming in here that kind of surprised you in a way?
Well, my first observation is the teamwork. And I had been in a regional office for a large portion or a large part of the COVID pandemic. And coming to Robert Wood Johnson University Hospital, I was able to experience the folks working together, the team, whether it be the physicians, the nurses, the housekeepers, just all the professionals under this roof that were coming together and making it work for our patients. I thought back just the other day, I was asked to think about the past year and all the sacrifices our staff made. And I thought of one big one that I could remember, and that was we were struggling at South Campus, which is one of our RWJUH Health affiliates, and they truly were loaded with patients, and they're a smaller facility, and they don't necessarily have the expertise that Robert Wood Johnson has in terms of the higher level critical care work that we do. And they were Robert Wood Johnson was accepting their patients and bringing their patients to Robert Wood. I had one of the rabbis call me, and he raved about the team at Robert Wood. So to answer your question, what I expected, great teamwork, but to see it in action and be back in the hospital and the excitement that a hospital can bring, it was special. And it always comes down to teamwork. That's what makes this place work. So, Bill, you've settled in now. You actually decided to stay at least more than 3 months. So we appreciate, the loyalty there. Particularly during a tough time. What kind of transitions do you see going on, particularly as we start to, become less COVID and more focused on our primary missions, and then moving towards the other major changes that are happening here? I mean, what are your observations about what you see going on? Well, I see less conversation around COVID, which is nice. I think we're getting closer to COVID being a bad memory, but a memory, something of the past. As the scientists tell us, we'll always have COVID presence, but we'll have it at a much lesser extent. So I see the shift from that day-to-day COVID conversation to more of a strategic conversation, a hospital operations conversation, whether it be academics, straight patient care, or even research. I've had many conversations with the leadership at the medical school, and again, it's much more strategic, much more conversation about what we're going to do as we move forward, and we get people back to work, and we get our schedules filled in terms of patient care. I know that's been a challenge for some, and so much virtual appointments are creating changes in our world. I spoke to one of the cardiologists the other day, and he told me you can always have the telemedicine visits, but it's not the same as in person. It will be a tool used moving forward, but he looked forward to seeing the patients back in his office, felt that was the better way to care for his patients, and that would create more flow back into the hospital, which will get us back to the norm that we once had here at Robert Wood Johnson. So, Bill, what excited
a number of us about you joining us here, and me personally, I am excited about, was that you have a broader perspective on the system functions than pretty much any other leader that, that's had an opportunity to start here and build here. Now you bring that kind of vision. At the same time, you're obviously very aware of what the hospital itself is and is capable of, and it starts a vision of what we can be as a true academic center. But so in that context of systemness, not sure that's truly a word, but I'm going to use it for the moment. And what are your observations about where we're headed, how we build in that direction?
Well, I think this medical center has an unbelievable culture of quality and patient sat and research, and that's special. It's great that we're focused on that, and now that we start to strategize a bit more, maybe outside the four walls of New Brunswick, I think that we need to work a bit with the system from a strategic standpoint. I believe that there's been a tremendous amount of investment in Robert Wood. And a perfect example is CINJ. We all know that there's an amazing project planned, and we now see the construction workers beginning to dismantle the school across the street, which will be our future home of the Cancer Institute of New Jersey. So that takes a team, and we can move so much faster if we work with our corporate service lines. So when I hear corporate, in this case, when it's cancer, I think of Dr. Steve Labuti and the team that he's assembling to create something special, both here in New Brunswick, but throughout the state. I experienced some of his work in South Jersey as we plan a CINJ outpatient facility in Tinton Falls. That's something that we've moved forward with, and we'll be breaking ground in about a year. I think of the cardiac work that's being done with Dr. Lenny Lee and Dr. Russo, and the work they're doing not only here but throughout the state, and connecting to the community hospitals as well as the physicians in those markets. Dr. Nanda, I think of him with his neurosciences. I was just recently at a community medical center board meeting, and one of Dr. Nanda's faculty, Dr. Johnson, was presenting on some advanced neurosurgical work that's being performed at community medical center. That wouldn't have been possible for a community prior to Robert Wood and Barnabas joining forces. Hey, system mergers, big mergers like this bring stress to everybody because it's change. We all would rather continue forward the way we always have, but there's a tremendous amount of opportunity on both sides. Robert Wood will benefit from patients coming here for higher level care in all those areas I just mentioned from much greater distances because of the span, the way this system spans the state of New Jersey. So I look at great opportunity for everybody. There will be win-wins across the state, and that's included here in New Brunswick.
Robert Wood has a long history of being a combined medical center, both academic, medical school, and private. Much like a Northwestern, or Weill Cornell, et cetera. And I think, one of the things that just excited me about your presence here is that you have a long history of supporting physicians in the private practice community. At the same time, to the words you just said, understanding the potential role of bringing academic expertise into that, that kind of environment. What kind of work do you think we should be thinking out is building this in the time coming forward here?
Well, I'll start with the community physicians. They're so important to our mission. They have been loyal to this institution. They trust this institution with their patients. And quite frankly, they have a patient following, and they've been part of the Robert Wood Johnson success, as has the medical school. So I once spoke to a dean from a large university health system out west, and at that time I was not yet at Robert Wood Johnson, but Robert Wood Johnson had just become part of the system, and the point he made to me is never forget your community physicians. Your community physicians are so important to your success. And he was someone he was a dean of a major academic medical center. He was pointing out the fact that you need to work with both your community docs and your faculty. I think we're poised to do that. A lot of the conversations I've had recently with different chairs, as well as the dean of the medical school, is just around that. I believe we have to build strategy that creates an environment for physicians to practice medicine regardless of who their employer is. And that's what makes Robert Wood Johnson special. We have a lot of different physicians and providers coming from different places, and they're working together and quite frankly creating some unbelievable results, and the patients are experiencing something special due to that. I think it's my job now to create the best possible environment for all those physicians and providers to practice, and that's something that we're going to be focused on. We just recently hired a chief strategy officer from Stanford, Kristen Peterson. I'm hoping everyone gets a chance to meet with her. I know that her phone's ringing off the hook, so she has a long list of folks to meet with, and she gets that piece. She's here to help me and help the system, as well as the physician leaders at University Hospital, to build and create the best possible environment for our physicians to care for patients and our patients to be cared for.
You mentioned some of the collaboration that we have already seen. Over the last several years down in the southern region, we've seen Robert Wood and Monmouth South community. You've really driven that kind of collaboration, urology, robotic surgery at Monmouth, peds especially down at community. How important is the physician voice in building those relationships?
It's very important. Anyone can build a strategic plan. It's the execution of that strategy, and in order to execute, you need to have physicians that are supportive and that had a hand in building this strategy. So in the South, the number one thing we did was we came together as leaders, whether it be physician leaders, administrative leaders, community leaders, and board leadership, and we worked together. We decided early on we would no longer compete against each other, but rather we would create create wins, and we come to consensus as much as possible. Every week I meet with the CEOs and leaders from the 3 hospitals in the South, and it becomes a think tank, and it becomes a non-competitive think tank, where some pretty smart people come together and debate, in many cases, the best way to move forward. A good example of working together is Monmouth Medical had funded certain, had capital funding and approval to move forward with some neuroscience product line. And the CEO there said, you know what, this market just doesn't support that. Let's do something in Ocean County because the market will support it, but let's limit what we do there so that we can move the higher level care to the place that truly has the resources to care for those patients, and that's Robert Wood. So again, it's you got to know the services that exist within a region. Robert Wood's in the central region, but it touches that southern region, and there's definite crossover. And I think working together and removing that obstacle of competition with yourself, That's what's most important. And the physician partnerships, that's what really gets it done. The physicians, they know how to make it happen, and then they can, if they're working with us, we can get it done for them.
So we have a remarkable list of projects that this hospital and system are working on simultaneously. The Cancer Hospital, New Surgery Center, St. Peter's merger, Neuroscience Institution, the IPA, all these, transitions. How can the medical staff support these efforts, to best optimize the chance of success, in all these complicated areas?
I think, again, working together, I know I say that a lot. We had a 5-hour session yesterday with the IPA and the leadership that has produced the IPA. And we had a very productive work session. And we started out talking about what are the obstacles within the IPA or the practice, the offices. And it was to me rewarding to see a group of physicians and administrative folks really get to the point where they were being critical of themselves, and in some cases, the services in some cases. And I think that's the first step when everyone can remove that fear of pointing out their own weaknesses, and that was removed yesterday. We listed every issue that we see as we move forward to set up a productive office practice. And this is a huge job that we have, or a piece of work that we have in front of us, and making these offices more efficient, more productive, so that we serve the needs of our community. At the end of the day, some may think it's for business purposes. That's nice when you improve the business line, but what's most important is access to care, giving patients access to care, having patients call for an appointment and not having to wait months to get into a specialist. These are things we discussed yesterday. I think we have some items to work on now that will create efficiencies and overall physician satisfaction as well as patient satisfaction.
How do we balance those critical needs and obviously opportunity to serve our community, to give critical medical care, with our pure academic interests and need, for basic research, R1 grants and stuff? How do we balance out those two missions simultaneously?
Through this negotiation of the IPA, we had the academic folks with a loud voice, and appropriately so, a loud voice, to be sure that we have the correct amount of focus on education and research. I believe that the leadership at Rutgers has a nice solid plan to continue to improve. In terms of the physician offices, there's a percentage of time that physicians will put forward, or academic folks will put forward, for clinical care. But there's also the protected time to guarantee that we move forward with our academic mission as well as our research.
Obviously, something is a sensitive issue for our medical school colleagues as they kind of negotiate these changes, which, as you point out, can be anxiety producing. But on the other hand, if they're open and if people are involved, we'll find the opportunity and the path, to get through that.
Yeah.
That's important. Well, as the springtime comes forward, what should we be looking forward to as far other than, having to actually start wearing sunscreen and getting outside? Any particular changes that you're excited about just in the short term?
I'm excited to break ground across the street for the Cancer Institute of New Jersey. I'm excited to work with the medical school leadership as well as the community physicians to start to develop the strategies that we will be moving forward with. I'm really happy that Kristen Peterson has joined us as our Chief Strategy Officer. As I mentioned earlier, her experience is vast in the academic environment. So I believe she's going to add a great deal of improvements in relationship as well as in strategy, which will ultimately be translated to a tactical plan that'll move forward. And what's nice about having your strategy figured out and a lot of fingerprints on that strategy, meaning we have medical staff, administrative staff, frontline staff, trustee staff, as they all get their fingerprints in, and we listen, which is very important. We listen to the ideas and expertise that we have here. We're going to develop a world-class institution and a world-class academic medical center. Now that doesn't take away what we already have. We have the making of something really special, but now bringing it all together and having a strategy that's transparent with timelines and accountability built in. I think the sky's the limit for New Brunswick.
So finally, I would be remiss if I didn't, for the medical staff, thank you on the rapid movement that you've done forward and pushing forward the new doctor's lounge. I know people, are very excited, about that. While I think people appreciate the previous new doctor's lounge in the East Tower, the fact that you have to hike a week and a half to get there, and it's a more limited space. It's now a new doctor's lounge right in the middle, and I know that's something that you made sure happens fairly quickly, and we're moving forward. I should thank you for that. I know people are very excited about that as an initiative, supporting, to the physicians, as well as, you're reaching out to communication. So I really do appreciate that very much.
And I thank you, and I thank Dr. Bachner. He's been on that as well. And to me, it's one of the most important investments we can make. I always said, I need to go to the physician dining room. At Monmouth, we had a physician dining room. I'd make sure I went there a few times a week. And you can return 15 calls in 5 minutes when you just show up in the lounge. You get so much work done. You really, that's where great ideas come out of a setting like that. So that's a worthwhile investment. I look forward to having a cup of coffee in the lounge with our medical staff and really getting to know each and every medical staff member over the next couple of years.
Yeah, that's an exciting new opportunity just for, as you point, the casual communication, and interaction that'll occur right at the core, of the hospital itself. So thank you again. It's really exciting.
Another point, if you have one more minute, that I'd like to make is the chairs. I met with the chairs as a group just a couple weeks ago, and we agreed we're going to have a monthly meeting. And I was really impressed with the chairs here at Robert Wood Johnson University Hospital. Again, they are a group of people that we need to be involved with. Like I hope the medical staff also is seeking out their chair, giving them their ideas, because we're going to be meeting, like I said, monthly. We have a nice agenda. Right now, we're focused on strategic plan, but we're also really focused on quality, our patient sat, and looking at the report cards that exist out there that we should be looking to be number one on. And I think there's so much opportunity. I know that the medical staff is actively working on the U.S. News and World Report recognition and voting right now. I hope we can get some momentum behind that kind of work. If we need to recognize ourselves for the hard work we're doing. And when I say that, I mean the medical staff and the department heads and all those people that are working so hard to develop these world-class programs. Let's make sure we let the world know and vote for ourselves.
Well, thank you very much. We really appreciate it. So, Bill, we really thank you very much for taking the time, to talk with us today. Obviously, you're welcome back anytime at all. In fact, we hope you will be back, fairly soon, with the next step in the saga. But again, thank you so much for the hard work you're doing. We really appreciate it.
Thank you, Dr. Salwitz. And thank you, Chris. Great job. Chris.
Lots of projects, lots of programs, lots of things to celebrate coming up in the future, more things to celebrate as we continue to grow, continue to improve. And I know you are a man that likes to get the staff together to celebrate accomplishments.
I do.
So hopefully plenty of those on the horizon.
There will be some. Thank you, Chris.
I'm looking forward to the toga parties. I just want to say.
Hey, the sky's the limit.
Bill Arnold, the interim president and CEO of Robert Wood Johnson University Hospital, thank you so much for your time.
See you soon, guys.
And as always, you can subscribe to Medically Necessary on all of your favorite podcast platforms. We're available on Apple Podcasts, Google Podcasts, Spotify. You can also catch us on YouTube and on the RWJUH Medical Staff Portal. For Dr. Jim Salwitz,
For Chris Hoenig,
thank you for listening.
Medically Necessary. Brought to you by the Robert Wood Johnson University Hospital Foundation.